But tonight we're going to focus on a question that concerns each and every one of us. Is the second COVID wave finally over? Is the worst over? And is a third wave now inevitable in the next couple of months? We'll be joined tonight by top epidemiologists and virologists from India and across the world. But first, let's tell you why we are raising this issue. Because India's COVID active case count is now 17,93,645. In the last 24 hours, it's 1,32,000 fresh cases added. Deaths in last 24 hours is 3,207 and recoveries are 2,31,456. Now, all of this is a major change from the 1st of May. Then India was recording 4 lakh infections on the 7th of May, with the country hitting 4.14 lakhs at the highest. The daily cases have also now come down, as I said, to 1,32,788. The death count is also dropping. In the first week of May, it started at 3,523 people, then went up to 4,329. It's now come down to 3,207. The most important figure to look at currently is the test positivity rate. The 7-day moving average on May 8th was 22.6%. It's been dropping. It now stands at just 8.2%. So there are positive signs at the moment that possibly COVID 2.0 may have peaked. Let's take a look, though, at the very start at a part of Mumbai which in a sense exemplifies perhaps what has gone right in India's fight against COVID 2.0. And that is the densely populated slum area of Dharavi. Dharavi has now declared itself once again almost free of COVID 2.0. But hold on, there is a problem, because vaccine hesitancy in Dharavi means that should there be a third wave, the slum area could again get vulnerable. Let's take a look from Sahil Joshi, our Mumbai Bureau Chief, on Dharavi and how that represents both the success and the concerns for the future in the fight against COVID. Take a look.
Dharavi, Asia's largest slum cluster with a population density of nearly 3 lakh persons per square kilometre. The chawls here are a potential sitting duck for the coronavirus. But Dharavi seems to have contained the virus once again. On Monday, the area reported only 2 new infections, the lowest since February the 11th. If the first wave took Dharavi by surprise, this time it looked better prepared, and the confidence is evident on the ground. Last year in May, Dharavi had 3 isolation centres for high-risk contacts and suspected cases. In 2021, all 3 isolation centres are closed. This year, Dharavi reported 3,011 cases and 42,000 contacts were traced. It had around 1,000 active cases on the 1st of May. Daily cases have dropped to single digits by the end of May.
The BMC had set up primary health posts inside Dharavi to keep a check on the spread of COVID-19 during the first wave. The health posts are still operational, but now they are being used to treat the kids, the young people who have been suffering from diseases due to monsoon.
The mood in Dharavi is of hope. Shops are open. Slum clusters that saw an exodus of migrant workers in the first wave now see them working in local industries.
नहीं अभी एक टाइम तो मैं नहीं गया था, यहीं पे हूँ जी, पहली बार गया था मैं जी। वो जो शेयरिंग में जो ट्रेन गई थी ना गवर्नमेंट की तरफ, उसमें गया था.
There are concerns though. The vaccination rate, for instance, is very slow. Dharavi has 3 vaccination centres, but out of the population of 8 lakh, in the last 2 months, only 19,638 people took the jabs till the 31st of May.
The response in slum areas, especially Dharavi, has been not that impressive, because initially when we start vaccination in March 22nd in Dharavi, we were quite confident that there should be a vaccination center in Dharavi, because most of the health workers as well as frontline workers were from Dharavi.
Vaccine hesitancy is a key factor here.
कुछ फायदा नहीं हो रहा है आदमी और उसमें उल्टा मर रहा है मर ही रहा है कोई कुछ फायदा नहीं हो रहा उसमें आप नहीं लगाओगे नहीं लगाएंगे हम तो
जो वैक्सीनेशन है बहुत बड़ा चैलेंजिंग बात है धारावी में लोगों को इतना मतलब अवेयरनेस नहीं है तो हम शुरुआत में जब भी वैक्सीनेशन सेंटर चालू हुआ था लोग इतना अवेयरनेस नहीं थे कि वैक्सीन लेना है उनको कुछ पता नहीं था
With the second wave subsiding, the focus in Dharavi is now on improving vaccination to avoid another spike. With Sahil Joshi and Pankaj Upadhyay in Mumbai, Bureau Report, India Today.
So let's raise that big question. Is the second wave that has really wrecked the country for the last 6 weeks nearing an end finally? But is a third wave inevitable? Are the projections of new waves being alarmist? Is the vaccination drive going to be the key to preventing a third wave and importantly lifting the lockdown as well? I'm joined by some of the country's top epidemiologists and virologists, Professor Bhramar Mukherjee, Department of Epidemiology at Michigan University, Dr. Shahid Jamil, the leading virologist associated with Ashoka University, Dr. Jaiprakash Mulyal is with the institute in Vellore, the country's leading epidemiologist. Appreciate all of you joining us. Let's come to each of you first for that initial question. Dr. Bhramar Mukherjee, you've been the one tracking it for us over the last several weeks. Can we say now with complete confidence that the worst is over, that the second wave can only decline from here on?
So thank you, Rajdeep, for having me on the show. I think that we have been tracking this pandemic for the not the last few weeks, but last 400 days. And all models, and including our model and IHME model, the Imperial College model, and many other models from India, predicted that the peak will come sometime in the early and mid part of May. And we have seen that in terms of the national counts. But as we start looking at these numbers decline, we can celebrate again that the peak has passed, but we cannot deny that we are in the middle of a global pandemic. So I would use cautious optimism here that there are many states which are doing extremely well, and you mentioned Delhi, but the lived experiences of people across India who are still fighting for hospital beds, who are still mourning the dead. We have to summarize all of that. And so I think I'm cautiously optimistic that the numbers at a national level are truly on the decline for the second wave. But there is a lot of heterogeneity across Indian states, and we have to be very cautious.
Let me take that point to you, Dr. Jamil, because while over 47% of India's districts are now showing a COVID positivity rate of less than 5%, there are at least 239 districts, that's about a third of the districts in the country, that are still more than 10% positive. So how do you interpret this data that's coming in? Should we be cautiously optimistic? Or do you believe that at the end of the day, even today, 3,200 Indians have lost their lives, so the numbers will remain high?
Yeah, Rajdeep, thanks for having me. You said that the positivity rate is down to about average of about 8%, 8.2%. So India is really not peaking or declining together. Different parts of India are peaking and different parts of India are declining. So if you just look at the average positivity rate, there are still 13 or 14 states that are above that number. And some of the larger states, you have Telangana, you have West Bengal, you have Tamil Nadu, Kerala, Andhra Pradesh, Karnataka. They're all above the average test positivity for the country. So that really tells us that it's not over. It's declining, yes. And I like that word, cautiously optimistic. But, it's not over. So let's not get complacent about it, that it's over. It may be over in the power center of India, which is Delhi, or maybe, getting down there with about 1% test positivity rate. It's certainly not over for much of India.
Important, I think, what you're saying. A number of the big states also of the country, you mentioned West Bengal, Telangana, Tamil Nadu, Karnataka, large parts of southern and eastern India, which in a sense were showing low rates in the first few weeks in April, are still very high. Let's get in Dr. Mulial. Dr. Mulial, are you willing to say that with the numbers coming down strikingly in parts of the country compared to, let's say, first week of May, where we were really at a peak, more than 4,000 deaths at the time, 4 lakh cases per day. The so-called second wave is over in your view, Dr. Mulian?
The main thing you should focus on is the so-called number we keep publishing, saying the total number cases detected so far. This number is approximately coming close to 3 crores. Unfortunately, this number is also an underestimate. But according to what the National Institute of Epidemiology says, you need to multiply this number by a factor to know the total number infected. And that comes to about 30 times the number we have diagnosed, which gives you about 75% of the population is infected. Now, the current re-estimates of a level of immunity that require is close to that. So yes, one can confidently say that we are approaching the end of this wave.
So you're more confident about saying it's the end of the wave. Are you saying, as a follow-up, Dr. Mulial, that you believe also that the third wave that people are talking about is being alarmist? Or is it inevitable that the virus will mutate and come back in another form? You seem to suggest that the second wave is reaching the end, but most believe that there is a third wave round the corner.
Well, you see, when 75% plus are infected, in fact, maybe higher, I'm using a rough estimate, it's at least 75%. The chance of another huge wave is extremely limited because it is very unlikely. You may get here and there outbreaks. Remember, last time when we ended the show and the whole epidemic started falling, the national infection rate was around 25%. So it was very surprising that the epidemic started ending then. There was some explanation for it, but apparently they didn't work. Remember, those days we were expecting a herd immunity level less than 60%. But the new viruses that we are dealing with are more infectious. As a consequence, the herd level that is expected must go up, unfortunately. Now, the question comes back, will there be a third wave? Well, I've heard this line being said, and people even have gone to the extent of saying it'll be a children's special or something like that. I don't think that has got any justification scientifically. A third, if subsequent small waves is possible in area where the infection rates are low. Remember, India is a large country, and there are certain areas where the infection rate are still low. There, it is possible to have some outbreak, but a nationwide, I don't think it is at all possible.
Interesting. Dr. Mulial, still holding on to your herd immunity theory, and you believe that since a large part of the country has been infected, only those that are not infected will face a third wave. Dr. Mukherjee, is it too early, premature to even talk about a third wave at the moment? Should we still be focusing on how are we going to get the numbers even further down as far as the second wave is concerned?
So my principle in terms of life and in terms of modeling is that really think about the next 2 weeks and in terms of what policy you are going to do and what the case count projections are like. Long-term projections, and we have seen beyond 6 weeks, beyond 8 weeks from many models, are not that reliable. I also want to say that we saw very high seroprevalence estimates from Delhi, from Pune in wave 1, and we still saw major outbreaks in wave 2. So according to our estimates, we estimate about 500 million infections in India. So that takes us about 36 to 40%. And that's not enough for reaching the herd immunity level. And again, our calculations could be incorrect. But learning from the second wave, I'll always err on the side of caution. And I'll do the right things in terms of thinking about astute strategies to exit lockdowns, manage the case counts every day, really be data agile and nimble, and look for any uptick and be prepared for the nth wave of the pandemic.
So to just understand, Professor Mukherjee, are you saying that the localized outbreaks of the infections will continue for several weeks going ahead, even before we could even think of a third wave?
That would be the natural thing to think, that, you know, as people are changing their behaviors and going out of the lockdowns, then we have to be extremely cautious with avoiding large gatherings and wearing our masks, and be at our best, like own personal prevention strategies. So I think that we have to focus on that work and not just think about the third wave. And we, of course, have to think about the future, but we cannot forget the crisis of the present.
We cannot forget the crisis of the present. Dr. Jamil, you know, you also made the point that we need to be very cautiously optimistic. I'm just trying to understand, in your view, are we being alarmist on the other hand when we talk of a third wave? As Dr. Mulyal says, there are people already saying children will be the most infected possibly by a third wave. Are we in a way looking at possible fear? Are we being excessively alarmist?
Well, I would not be alarmist, but as Dr. Mukherjee said, err on the side of caution. We've been burnt once. We were complacent and we were burnt that time. So I would really err on the side of caution. And I really think that this third wave, whether it's a wave or a blip or whatever it is, the intensity of it and when it will come will essentially be determined by our behavior when the lockdowns open. It will depend on how quickly we are able to roll out vaccines to a large population, and of course, whether any further mutations develop. Now, we don't know whether this virus has exhausted its capability to mutate. Since the pandemic began, just in the spike protein of the virus, there are a reported 750 mutations. And these are mutations that are present in at least 100 virus sequences from around the world. And there are about 1.5 million sequences in the database. Now, we don't know whether the virus has saturated itself out in terms of mutations or still has the capacity to mutate. My sense is that it still can throw a few pricks towards us. So I would rather be, again, cautiously optimistic and err on the side of caution.
So are you saying, Dr. Jamil, there could be another B.1.617.2, the variant that affected 3/4 of India's population in this second wave, another variant out there, and therefore we cannot let our guard down, A, and B, therefore vaccinations become the key. The faster you vaccinate, the better the chance of avoiding another infection outbreak.
Right. Look, B.1.617.2, which now in WHO's language is called Delta,
yes,
is finally a variant of concern. Remember, 617.1 is still a variant of interest. What if that picks up another mutation along the way, which allows it to bind a little better or allows it to evade pre-existing immunity? So all I'm saying is we don't know whether the virus has saturated itself out. And we already know that breakthrough infections are happening because of mutant viruses, even though studies in India are not really very good on that account. But whatever we have, we know that.
You know,
so
that is the fear, isn't it, Professor Mukherjee, that this could be the year of variants. We've had B.1.617.2 or Delta as it's now referred to. There could be another one round the corner. To that extent, do you believe that we cannot lift the lockdown therefore at the moment? I mean, since that is the major concern, that are we simply going to have to just hunker down till we are sure that there are no more variants out there? And when will we be sure of that?
I think we have to strike a balance between science and pragmatism here. I don't think any society, any country can hide behind the curtains of lockdown in perpetuity. So we have to think about exit strategies. We know a lot about how this virus transmits and spreads, so we have to really use that science as we open up. And there are places, it's not going to be uniform across India. As it was mentioned, there are several states nowhere near close to lifting the lockdowns yet, including my own state, West Bengal. And then we have to really strategize, optimize our lockdown strategies, avoid like indoor places where you have to take your masks off.
But sorry to intervene, is there a point at which as an epidemiologist you decide, okay, now we are safe? I mean, is it positivity rate that you look at? What do you look at before you would advise a state government, look, you can now lift the lockdown?
So I think there are multiple metrics, and again, the policymakers make the decision. The statisticians and the quantitative data scientists only provide the information. And the test positivity rate, also hospital capacity, that's a key metric, that whether you can take care of, if there is an outbreak with the opening strategy, you can take care of the patients. But also I would say that you really think about the strategy going forward, the long-term strategy of, as Dr. Jamil mentioned, of sequencing the breakthrough infection, sequencing reinfection, gathering more data on this vaccine and variant interface. But the key thing is really accelerate vaccination. That is really, in the United States, 6 months ago, we were in a very different situation. And now the Memorial Day weekend is so uplifting for the community to be able to see each other again. So I think that vaccination is the key here towards opening up and gathering more data on the variants.
I'm going to have a separate debate on that because the government is saying 1 crore vaccines per day from the 15th of July. But let me get in Dr. Mulyal, because you're a bit of an outlier in this discussion. You seem to believe the worst is over. You're not so confident that there'll be a dramatic third wave. But let me push you on this. Were you not surprised by the sheer intensity of the second wave? That somewhere, Dr. Mulyal, the sheer intensity of the second wave caught you and others a little bit off guard?
The intensity in terms of the attack rates. When you calculate the contagion's ability to infect others, we calculate a basic reproduction number. This new virus was much more infectious than the first Wuhan virus that visited us. So there were so many variants, nobody showed that, but 2 or 3 variants really showed a distinct increase catchiness, so to speak. That means your basic reproduction number changes, and consequently the herd level that is required also goes up, which is unfortunate. So but in today's current situation, the proportion of the population which is still naive, not infected, is shrinking to a small extent. It'll be maybe 25 or 20%. Now that is our protection. That is, a bulk of us are already have antibodies against it. If we had the vaccine too, we could to some extent close that gap more efficiently. But even then, that vaccine will not be the only protection against a new variant which ignores all previous immunity. So I think we are talking about something disastrous, and I don't think we should spend time on it. We are happy to see things are coming down, and I think we can start life again back in India.
That's the positive in you. Let me ask all of you, therefore, in conclusion, Dr. Jamil, would you say in a way that a couple of months down the line, assuming that the government actually lives up to its promise of 1 crore vaccinations a day from the middle of July, come August 15th, and I'm using that as an Independence Day reference, we should be in a better position than we are today, despite the fact that there are still several districts with 10% plus positivity rates?
Well, certainly, provided that all the other parameters remain the same and vaccination rates go up, but the virus continues to behave itself. The problem is that you can't predict. Mutation is a completely random event. And, how a variant emerges, how the mutation is selected, we have very little understanding of it. And I'm actually quite surprised that with 1.5 million sequences already in the database, with a date on every sequence, we haven't yet figured out what mutation comes after which mutation. There is of course some big data analysis. There's some things that people like Dr. Mukherjee should be able to do. I'm certainly not capable of doing it, but I'm quite surprised that hasn't been done, or maybe it has been done and I just don't know about it. But some predictability would really help us.
Some predictability would help us. You're saying, therefore, you're being cautious again, cautiously optimistic, and the last thing we need to be is complacent, as we were perhaps at the start of the year. So, Dr. Mukherjee, are you going to help us in conclusion with some predictive behavior? What can we expect August 15th? I'm sorry to again look at that date, because Independence Day liberates us in a way that's about 2.5 months down the line. Will we be in a society where many more states will have opened up completely? Can we really look at, as America, as you're saying, is getting ready for Memorial Day and possibly July 4th, will we be able to celebrate August 15th truly by being out in the public, or do you believe that would be excessively optimistic?
Thank you for that question. I think I keep saying that the stochastic crystal ball has finite radius. So I would say that everything depends on vaccination. If you look at United States, the vaccination numbers in adults and even in kids 12 to 18 is really encouraging, and that's why people are able to gather outside, but again, very cautiously. It's not like the same old days again, because you still are forming your circles, you are still wearing your masks inside. So I think this is going to continue for the foreseeable future. And again, from 15 July, it's if we get to those 10 million doses a day, that would be very encouraging. But the fact is that in order to vaccinate the adult population in India, you need 1,600 million doses, and we are at 218 million doses. So we have a long way to go. So I would hope that Independence Day really stimulates a very positive encouragement. But again, science does not go by these sentiments. Science progresses by what we are able to do on the ground. So it depends on us. It depends on policymakers, what we are able to accomplish.
One final word from you, Dr. Mulyal. 2 months down the line, better position than we are today, since you seem to be telling us with confidence that the worst is over?
I think very confidently now I can say the worst is over. Okay, a meteorite may fall on us. That is something we can't help in. But in terms of the current understanding of the science, the worst is really over.
I hope we can all be as optimistic. It's always good to have Dr. Mulyal with his optimism on the future. But as Dr. Jameel and I think Brahmar have pointed out, this is a time to be cautiously optimistic, and much depends on getting the vaccination drive right and which way this virus goes with its variants. This is the year not just of the virus, but of variants as well. Thank you all so much for joining us. Very educative and truly news without the noise. Dr. Jameel, Professor Mukherjee and Dr. Mulyal joining me here on the news today. And